The gentlelady from Missouri, Ms. Bush, is now recognized for her questions.
St. Louis, and I thank you, Chairwoman Maloney, and to the committee for convening this critically important hearing, which represents our steadfast commitment to achieving universal health care coverage in the United States. For my colleagues on this committee, you have a choice in front of you today. It's a choice to save lives or a choice to let people die. Disproportionately low-income people, Black people, brown, indigenous people, die. Because you are a human, you deserve health care. Because you are a human, you deserve health care. In my community, Black mothers die at 3 to 4 times the rate of white women. In my community, Black babies are nearly twice as likely to die prematurely. I came to Congress because enacting Medicare for all, it's not a choice for me, it's a moral imperative. When I worked as a nurse, I cared for uninsured and underinsured patients every single day. I'm reminded of one patient with diabetes who was failed by our healthcare system because she could not afford all the aspects of her care. Technically, she had insurance and a primary care provider, but she could not afford her insulin prescription, her needles, her test strips to track her blood sugar levels. This patient, she was forced to ration her insulin, and she skipped appointments due to transportation, making it difficult to follow treatment plans. This patient ended up losing a limb, and eventually she died. One health condition, if left untreated, can be deadly. For me, after I turned 18 years old, I became an uninsured low-wage worker. I could not afford to retain a primary doctor, so I went to the emergency room for treatment for conditions like asthma, sinus infections, and toothaches. My asthma was exacerbated by environmental pollution and degradation and continued to worsen without proper medical care. During the Ferguson uprising, toxic tear gas filled my lungs, leaving me gasping for air, and it worsened my condition. Even though I was working as a nurse, I was forced to pay a $900 monthly premium, a $4,600 deductible, and struggled to treat my asthma. Dr. Michener, can you please describe the relationship between healthcare coverage status and economic mobility in the United States? How would Medicare for all reduce poverty and stimulate economic growth in the United States?
Representative Bush, thank you for the question. I think this is a key dimension. Oh, I thought it was on. Mm-hmm. Oh, okay, yeah. I think this is a key dimension of this discussion that I think that on some fronts has been willfully ignored, which is that there are gross inequities, not just in our health system, but in our economic and social and political systems more broadly. And the inequities in the health system are exacerbating the inequities in other places. So if we look at all of our anti-poverty programs that we have in this country, the largest effect on poverty, child poverty in particular, but poverty more generally, comes from our Medicaid program. Addressing health care disproportionately addresses some of the other core and fundamental challenges we have around economic inequality in this country. And so what happens when you provide people with health care? We've seen it through Medicaid. They're less likely to be evicted. They're less likely to recidivate and go back to prison. They're more likely in the long term to have positive financial outcomes.
Yes.
Less likely to be living in poverty. Less likely to have medical debt. More likely to have positive educational outcomes. More likely to have employment. We want to say socialized medicine, quote unquote, scare people away with the scary phrases, right? Oh, the government is going to be making the decisions.
Right.
If the government is not making the decisions, who is? The market. And that is not democratically controlled.
Thank you.
It's not something that people can influence.
Thank you. If not 3 years into the pandemic, when will we actually address the fundamental flaws and structural inequities present in our healthcare system, in our privatized healthcare system? Dr. Blackstock, using your extensive experience as an emergency physician, can you please describe what the implementation of Medicare for All would look like for healthcare providers, particularly those who interact with insurance companies?
So what it will do is it will enable us as healthcare providers caring for our patients to more efficiently care for our patients, to prioritize their primary and preventive services that we provide them. It will not result in more administrative effort and cost. In fact, it will do the reverse. And so it'll help remove barriers for our patients to seek care, and in doing so will enable us to provide the best care and to do so even more efficiently than we can do that now.
I would say yes to that as the nurse that actually worked the bedside. That is true. Thank you, and I yield back.